this video is to show you the skill of obtaining a blood serum sample. As always, when you enter a patient's room, you want to knock on the door and introduce yourself. You always want to verify the patient's identification with 2 identifiers, and we want to always double check our physician's orders prior to doing any procedure. For a blood draw with a central venous catheter, we always want to use the brown port. This is the most distal port, which gives us a better access, and it also is the largest port of the central venous catheter. When obtaining a blood serum sample, you want to have a sterile syringe, and you also need 2 sterile normal saline flushes. We begin with clean gloves on our hands. We explain the procedure to the patient, and we go ahead with our procedure as long as the patient is able to understand and cooperative. We'll use our alcohol swabs to clean the hub prior to doing any blood draws. So to begin with, I want to remove my alcohol-infused cap, and I still want to clean that hub for 10 to 15 seconds prior to applying my saline flush. We will apply our flush and unlock our lumen, and we're going to start flushing and then pulling back, checking for patency during this time. We'll flush our entire 10 mLs, and at that point we're going to go ahead and pull back and withdraw 10 mLs of blood to waste. We'll clamp our tubing, discard this in the biohazard, and now we're going to apply our new sterile syringe after we clean our hub one more time for 10 to 15 seconds. Once that's done, I will apply our new sterile syringe, unclamp my lumen, and withdraw 10 cc's or whatever has been ordered of blood. And we're going to clamp this off again, and we will send this to the lab or have the lab person label at the bedside and take this to the proper area. We'll get another new alcohol swab, cleanse, and we're going to flush one more time with our 10 mLs of normal saline. And we will lock that off with positive pressure towards the end. Most facilities require for a cap change, as shown in a previous video, after you've done a blood draw from a central line catheter. If it has been ordered, we would use heparin. Typically in our case, it's 2.5, and we would always ensure that the patient's comfortable and there was no complications during the procedure, and we would document, and we are done with obtaining a blood serum sample.